Tonight, before you go to bed, I want you to do something unusual. Look at your calendar and think about the last time you went to the doctor's office for a routine checkup. Because researchers studying older adults discovered that one common habit, simply saying yes to every routine screening, is secretly linked to higher rates of strokes, heart attacks, and a permanent loss of independence. Millions of people over 60 do it every night without realizing it. The question is, are you one of them? We've been taught our entire lives that more testing equals more protection, but according to data from geriatric studies, that belief is dangerously wrong after the age of 65. Studies estimate that between 15 and 25% of all medical procedures performed in the United States every year are completely unnecessary, and that percentage climbs sharply for seniors. After 65, aggressive preventive testing often carries more physical burden than potential survival benefit. This happens because of a dangerous chain reaction known in medical literature as the cascade effect. It works like this. One routine test finds a small, harmless abnormality. That abnormality triggers a follow-up scan. The scan recommends an aggressive biopsy. The biopsy leads to a procedure, and the procedure causes a major complication. The nightmare doesn't start with the surgery. It starts with that first innocent test. Based on official screening guidelines from top medical organizations like the U.S. Preventive Services Task Force, USPSTF, and the American Cancer Society, here are 5 specific checkups you should reconsider after 65 because the risks completely outweigh the benefits. Number 5. Routine. PSA prostate testing. Past 70. For men with no symptoms, it catches slow-moving tumors that you would naturally outlive. However, that elevated result triggers immediate biopsies and harsh treatments like radiation or surgery, which carry high risks of permanent impotence and incontinence. Number 4. Routine DEXA bone density screening paired with automatic pills. It frequently locks seniors into long-term drug pipelines, like Fosamax. What doctors leave out is that using these drugs past 5 years is actually linked to atypical femoral fractures, literal stress fractures in the thigh bone you were trying to protect. Number 3. Routine cardiac stress testing without symptoms. If you have no chest pain or shortness of breath, routine stress tests have a massive false positive rate reaching 40%. That false alarm forces you into a cardiac catheterization, leading to an unnecessary stent that major clinical trials, like the ischemia trial, prove does not reduce heart attacks compared to standard medication and a simple walk. Number 2. Routine carotid artery ultrasound. This checks neck vessels to catch a silent blockage. However, the surgical procedure used to clear that blockage carries a 2 to 3% risk of triggering the exact stroke it was meant to prevent. Number 1. Routine colonoscopy. Past 75. The physical burden is severe. A bowel perforation, a literal tear in the colon, occurs in 1 out of every 500 colonoscopies in older adults, turning a routine day into a life-threatening surgical emergency. Are you currently trapped in this screening loop? Ask yourself this critical question right now. Am I ordering this test because I actually feel sick or have symptoms, or am I just doing it out of habit because the calendar says it's been a year? If you have no chest pain, no unexplained fatigue, and no pain, you need to pause. The biggest mistake seniors make is assuming their doctor has time to calculate this complex risk-to-benefit math during a rushed 15-minute appointment. The medical system is built on an automatic treatment button. The clinical solution is to shift your focus from invasive testing to non-invasive optimization and fall prevention. For instance, studies prove that structured balance training like Tai Chi reduces actual fracture risks by close to 50%, far outperforming bone density pills with absolutely zero side effects. Before your next appointment, drop your city or state in the comments right now to join our health-conscious community. And here is a piece of extra value. Always ask your doctor about non-invasive stool-based screenings like Cologuard. Instead of jumping straight to a physical colonoscopy, it flags genuine warning signs without any procedural risks. Consider the case of Margaret, a 78-year-old from Ohio. Her prior scopes were perfectly clean, but she was pushed into a routine colonoscopy. The intensive prep liquid severely dehydrated her body overnight. Before she even reached the procedure clinic, she was rushed to the ER with a strained heart and critical kidney stress. She spent 5 days in the hospital recovering from a test meant to look for a disease she didn't have. As she said later, "I felt better when I was overdue for that test than I did after trying to take it." Starting today, put these 5 protective questions in the Notes app on your phone and ask them before saying yes to any routine test. 1. What is the false positive rate of this test for my age? 2. If this finds something, what are the realistic treatment options for my health status? 3. What is the procedural risk of that treatment? 4. Can we safely monitor this instead of treating it immediately? 5. What is the most effective, non-invasive approach for this condition? Asking questions isn't being a difficult patient, it's being a protected one. Share this evidence-based video with a sibling, spouse, or an adult child who manages family health. Hit subscribe because next week we are exposing the specific daily prescription medications that completely shift their danger profile after age 65. Take care of yourselves, and I'll see you next week.